Hey there, everyone. Welcome to the Beard Signal, the only podcast where public health meets public outrage, and the host has more facial hair than the former president and current president have healthcare plans. I'm JP Dunphy, and today we're going to be diving beard first into a topic so messy that even Dr. Fauci wouldn't touch it without gloves. And that's how the Trump administration's health policies have turned a crisis into a catastrophe. And then tried to blame kale and pronouns for the fallout. So let's take a moment to realize this whole MAHA report, let's dive right into the eye of the hurricane here. The Make Our Children Healthy Again report, also known as the MAHA report. So Make America Healthy Again thing. If you haven't read it, consider this your spoiler report. But I made the misfortune of actually reading the whole thing through and finding a lot of things questionable, only to find out literally 2 days after I finished it and was writing this entire episode that, holy crap, basically the entire thing is just pull out of nothing. No surprise. It's Trump and his goons, and the guy who's running it has, brainworms. So, whatever. So, bottom line, I read through this whole thing, and they found out later that there's a bunch of other issues with it. And on the surface, it poses as a nonpartisan health assessment. It calls out legitimate issues like childhood obesity, poor nutrition, and rising chronic illness, which is an actual problem here in the country. But you dig a little deeper, and you'll find a document drenched in culture war talking points, ideological scapegoating, and basically policy amnesia. And another little spoiler is that it didn't even take very long to find out that when you look at the sources at the bottom of this entire steaming pile of donkey dung is that most of the things that are sourced don't even really exist. The research papers and reports literally don't exist. They had real people connected to it, but you ask those people, like, hey, do you write this? And they go, I've never heard of that report before. So it's just ridiculous. So it frames the entire public health crisis as a moral problem, not a systemic one. On one side, probably. It is actually partially moral and partially systemic. But the problem is they completely ignore this systemic bit, and according to the MAHA reports, kids are basically sick because they eat too much ultra-processed food, which is true, but vastly oversimplified. They use too much technology, again, not false, but also without nuance. They're over-medicated, so you blame modern medicine for the problem of it that often mitigates. And don't get me wrong, I do think that there is severe over-medication. I went through it myself as a child because my mother, loved her to death, but she basically tried to medicate me for things that were just completely normal for my age. So, and most of all, they're subject to harmful cultural influences, which is basically like just dog whistles for gender diversity, liberal parenting, and anything not in line with their traditional values, which are beyond flawed by any measure of anyone who's educated. So what's missing? What's missing is any meaningful accountability for corporate monopolies that shape our food access, missing the whole polluting industries that contribute to rising disease, and yes, the very administration that disbanded the safeguards and kneecapped regulators that were meant to protect the children in the first place. Again, I've said this in other episodes that I get public at. Republicans break shit, kneecap stuff all can, and then point to the thing that they kneecapped, saying that it doesn't work and this is why it should be privatized. They've been trying to do this since Reagan. And they've seen in some areas, college is one of them. College was going to be, but that's going to be a whole other thing. Let's just get to the main point. MAHA, not MAGA, but MAHA, and probably parts of MAGA, blames you, the parent. It blames the single mom, the queer kid, the overstretched teacher. It never blames the policymakers or the corporations profiting off systemic breakdowns. So it's not a report, it's a smokescreen. The bottom line of this is there are parts of this that are completely just null and void of any substance and legitimate points. Like, for instance, the processed food. I agree. I think our kids actually have way too much processed food, and that can contribute to lots of things later on in life. I don't disagree with him on that. A broken clock can still be right twice a day here. But here's the legacy of the Trump administration's health agenda. It goes from basically negligent to deadly. So in 2018, 2 years before COVID, the White House shut down the National Security Council's Global Health Unit. All right, that's the very team that was meant to coordinate a pandemic response. Then, when COVID-19 emerged, Trump downplayed it as just like the flu, called it a Democratic hoax, and then claimed it would disappear by Easter. All right, he held rallies in packed stadiums while his own experts warned against these kind of gatherings. He refused to wear a mask. He's sending political signals that public health was optional, if not unmanly. And then came to hydroxychloroquine hype, the bleach injection comments, the open feuds with Dr. Fauci, the politicization of lockdowns, and the delay in invoking the Defense Production Act, which, funny enough, after all that talking against it, Trump actually made it happen fast. So it's like, rail against it, but then want credit for the thing that you rail against in the first place. It's just stupid as the hell. And everyone seems to have amnesia about that, which is why I'm amazed this guy's back in office again anyway. So, according to a Columbia University study, over 400,000 American deaths in 2020 alone could have been preventable if the administration had just acted weeks earlier. And yet, the MAHA report doesn't mention that number, not once. The Trump administration's COVID response wasn't just a policy failure, it was an ideological crusade against science, facts, and accountability. It was a masterclass in how not to lead during a public health crisis. All right, and another thing that really annoys me personally is that public health isn't an individual thing. It's you, the individual, are helping everyone around you. It is a universal thing to be like, hey, I would like to be healthy and other healthy people to be like that around me. And it's probably time for another episode. But let's just talk about the assault on science, all right? A quieter but just as devastating crusade of the Trump era. So under Trump, scientists have been muzzled, public health guidance was rewritten by political staffers, which was detrimental to all hell, and then the CDC was actively blocked from issuing information in contradiction with whatever the White House is messaging. So reports had surfaced that words like transgender, diversity, entitlement, and evidence-based were literally blacklisted from government documents. The nation's most trusted institutions, the CDC, the NIH, and the FDA, were warped by pressure to conform to ideology rather than inform the public. They even prevented them from releasing reports for a while there. And this has long-term effects. It undermines public trust in vaccines and public health measures. It fuels conspiracy theories and anti-vax movements. And it politicizes the disease itself, turning masks into a tribal symbol and COVID into a partisan identity test. So, you can't lead a country through a public health emergency when your administration treats expertise like it's an enemy combatant. All right, and then there's the entire healthcare sabotage. So let's just rewind to one of Trump's top campaign promises. We're going to repeal and replace Obamacare. And what exactly happened? Over 4 years, the administration tried to repeal the ACA more than 70 times. It failed to pass a replacement bill. It cut funding for the ACA signups and outreach by 90%. It eliminated cost-sharing subsidies, causing a spike in insurance premiums. It promoted junk insurance plans that didn't cover any of the essential services like maternity care or prescription drugs or hospitality. And as a result, millions lost coverage. Insurers pulled out of ACA markets. Rural hospitals have been closed, and preventative care, screenings, vaccines, and regular checkups have been denied, especially in red states. There was no plan, it's just sabotage. A scorched earth campaign against the one system giving millions of Americans a fighting chance at health equity. Now, do I think personally that there should be actually a universal health care, just like every other major country in the frickin' world? Yes, I do. Is that probably going to happen here? No, because we're too entrenched in other ways until other reforms are going to happen. But let's talk about the people Trump's health agenda has left behind. Just because it isn't just collateral damage, it's literally a targeted neglect. So, first and foremost, Black Americans died at twice the rate of whites from COVID-19. No national strategy was deployed to address this racial disparity. LGBTQ plus people, especially trans individuals, lost protections on the ACA, opening the door to denial of care based on gender identity. Women, especially low-income and rural women, lost access to reproductive health services after Title X was gutted and Planned Parenthood was defunded. And then children with disabilities saw cuts to Medicaid programs that fund speech therapy, occupational therapy, and behavioral supports. Those are things that literally, two of those things are literally my own kids have. All right? I have kids that are of need, and it literally cut them. And yet MAHA, in MAHA's whole thing, the villains were the pediatricians. The culprits were woke schools or Real crimes were white suburban parents who tried or are being forced to wear masks at the PTA meetings. It's gaslighting, plain and simple, all right? And healthcare doesn't even start at the doctor's office. It starts in the air that we breathe, the water that we drink, and the soil that our kids play in, all right? The Trump rolled back more than 100 environmental regulations, including mercury emissions from power plants, the clean water protections for streams and wetlands, fuel efficiency standards, emissions cap for methane, which is one of the most dangerous greenhouse gases, and let's be real, these rollbacks don't hit everyone equally. They hit Black and brown communities living near these industrial sites more heavily, poor kids breathing in smog from highways and coal plants, and indigenous families fighting off toxic water while the EPA looked the other way. You can't separate environmental policy from public health, and yet Trump's approach treated pollution like it's an inconvenience for businesses, not a death sentence for the frontline communities of these places that are directly affected. Let's just put it all together here, all right? I know it's only been 12 minutes and I've been basically shoving as much stuff down here as I possibly can, but over this time, I'm trying to walk through a legacy where the Trump administration would rather have you forget. A legacy now being rebranded as health heroism in the Make Our Children Healthy Again report. But here's the unvarnished truth. This Trump administration has dismantled pandemic preparedness before the deadliest global crisis in a century. It politicized science, treating experts like their enemies and facts as threats. It sabotaged the Affordable Care Act without offering replacement, just slogans and suffering. And then it targeted vulnerable communities like the LGBTQ plus youth, black families, poor women, and disabled children. It guts environmental protections, treating pollution like it's a policy afterthought instead of a public health emergency. The ridiculous thing is that they're blaming kids' screen time, trans healthcare, and single moms for American chronic disease crisis. It's not policy, it's propaganda. It's a desperate attempt to rewrite history with a Bible in one hand and a campaign donation in the other. But here's the truth that you really can't bury. Public health crisis isn't a culture war. It's a human right. And in any government that strips that away, although neglect, denial, and cruelty should be held to account, let's be clear. The kids in hospitals today, the families who just lost loved ones from COVID, the millions of rationing insulin because, or maybe skipping cancer screenings, the queer teens that are denied affirming care. They are not collateral damage in some ideological crusade. They're victims of a calculated and it's a calculated dismantling of a system that we are supposed to use to protect them. All right, you can't make America healthy again by ignoring science. You can't make children healthy again by attacking their parents. You sure as hell can't lead a health revolution while cashing checks from big pharma and fossil fuel CEOs. If we want to have a healthier nation, we need to start with truth, not theater. We need actual investment, not ideology, and we need solidarity, not scapegoating. Let me just pull something of this up here, because this is just, again, just to cover this. Take my actual side notes here and move it up a little bit. Something that frames an entire health public crisis as a moral problem and not a systemic one, because kids eat too much ultra-processed food, use too much technology, over-medicated children, and most revealing of it all is that they're subject to harmful cultural influences, which is a dog whistle for everything else. And again, what's missing from the entire report is meaningful accountability for corporate monopolies that shape our food access, polluting industries that contribute to the rising disease, and yes, the very administration that has disbanded the safeguards and kneecapped the regulators that were meant to protect children in the first place. MAHA blames you, the parent, the single mom, the queer kid, everyone that literally should never be blamed for something that most likely, in 99.9% of cases, is going to be out of their control in the first place. So, don't want to make this one too long. I know my last couple have been longer, so I'm going to cut it off there. This has been The Beard Signal. I'm JP Dunphy, and I don't have all the answers, but I won't stop asking the questions. I won't stop looking into things and actually doing my research before bringing something out to you. I don't want to make a mistake and tell you one thing when the opposite is true. All right? So, if this episode struck a chord, share it, subscribe, boost the signal, because the cost of truth is steep, but the cost of silence can be deadly. That's all for this episode. Thanks for your time. Have a great one. Keep the signal strong.